You know what to do if someone is having a stroke. Urgency is the key for an accurate diagnosis, treatment, and recovery. So here to tell us more is neurosurgeon and spokesperson for the American Stroke Association, Dr. Alexander A. Kalesi, and EMS professional and stroke survivor, Avi Golden. Good morning, folks. Nice to have you with us, imparting such good information for us.
Good morning.
Doctor, why is it important to recognize stroke right away?
Well, it's a very exciting time in the treatment for stroke. I think it may be helpful for your viewers to first identify what a stroke is. It's essentially an interruption of blood flow to the brain or a bleed within the brain itself. And so you can imagine if there's this ongoing injury to the brain taking place, it's critically important to seek care and interrupt that process.
Now, Avi, you had a stroke, but your case wasn't typical. Maybe you can tell us how we can recognize the signs.
Sure. Is a FAS. Sorry, I have a stroke, so it's hard to communicate, but FAS. Basically, face droop up, arm weakness, muscle speaking, and time to call 911 is important.
Yeah, you know, I think as Avi outlined in our Together to End Stroke campaign, one of the things we really want to emphasize is that FAST acronym. That is asymmetry of the face when you smile, weakness of your arm, a disruption of speech, and then that means it's really time to call 911 and seek immediate care.
And Dr. Kalesi, speaking about calling 911, it's really important to do that and take the ambulance to the hospital rather than try to transport yourself. Why is that?
Precisely right. I think we all like to think we can move quickly on the road, but there's no question that transport times with ambulances are fastest. But there are two other key reasons why taking an ambulance is important. As we talked about, strokes are a progressive process, and so God forbid you were to deteriorate or get worse on the way to the hospital, you want to be around trained medical professionals who can keep you safe and manage that situation. Lastly, many systems have something called pre-hospital notification. So stroke care is very much a team sport, and so that EMS professional is going to be radioing ahead or calling ahead to the hospital that they're bringing in a stroke patient, so that hospital's mobilized and ready to run with that ball and provide you the best care when you arrive.
Avi, we're so happy to see that you are recovering from your stroke. What were some of your treatment options?
Sure. After the stroke, like for example, food and vegetables, like good stuff, or gym, a lot of gym, stuff like that is also stuff like that for me.
So Avi's done a lot of things in terms of lifestyle modification to protect him from a future stroke and to support him through his new deficit. But one of the reasons we're emphasizing seeking care very quickly is because we have really exciting new effective treatments for stroke. It used to be the only way we could relieve a blockage is with a very powerful blood thinner called IV TPA. But you can imagine that the larger the artery in the brain that's blocked, the more severe the stroke, and unfortunately the less effective TPA is. And so in the last 5 years, we have new, very exciting catheter-based technologies that allow us to open that artery with devices like stent retrievers. And so that new catheter-based procedure makes it all the more important, particularly in severe strokes, to seek immediate care.
All right, and very, very quickly, I know, check with your doctor for the very best ways to prevent a stroke, or also go to the information that you left us. And it's go to Together to End Stroke. And that's an initiative that's going on right now through the American Heart Association. Gentlemen, thank you so much. Avi, it's great to see you looking good. And Dr. Kalesi, thank you for your expertise on this. A lot of people will take it to heart and hopefully do exactly what you're saying so we can all be more educated about stroke treatment.